Good afternoon, everyone. Thank you for coming to the City Hall atrium. We have something special planned for you today. This is part of a new series that we are partnering with Pinnacle Health to achieve. We are here to promote health and wellness in our capital city and the region. I want to thank Pinnacle Health. They have been a very strong supporter of Harrisburg and its residents. They're doing some wonderful things. Not only have they provided for our fire cadets and our new police recruits physical screenings, which have saved the city thousands of dollars. But we're also here, and I'm joined by Captains Cleary and Moody, to announce that they will be providing free health screenings to all police officers as we move forward, which is a tremendous thing, a wonderful thing for the city. One of the things that we're announcing as we kick off this new speaker series is that if you come to this atrium, we will have quality information about the major health issues that impact our city. You can come and you can find out information about high blood pressure, about diabetes, about childhood obesity. Thanks to Pinnacle Health, we're going to keep that information consistently stocked here in the atrium. But in the month of July, on Thursdays, we're doing something even more special, which is we're having a new speaker series, and we're going to inaugurate that today. But if you come next Thursday, and I believe next Thursday starts at noon, or at 11:30 perhaps, at 11:30 here in the atrium, we're going to be doing health screenings. So if you'd like your cholesterol checked or your blood pressure checked, if you're watching this at home, come on down to the atrium next Thursday and we'll do it for free. Make the time on your lunch break to come down here and we'll get it done. And I just want to say that I am trying to lead this new Healthy Harrisburg initiative by example. And as Joyce Davis will attest, I have brought the elliptical machine up to the mayor's office in the mayor's suite, and I am now using it daily. So after this, if the media would like to come up and see the elliptical machine, I am happy to demonstrate its usage. But before we do that, I want to introduce somebody very special. I want to introduce Dr. Barbara Terry, who's the Vice President of Pinnacle's Mission Effectiveness. What a great name. She'll talk about Pinnacle's commitment to the Healthy Harrisburg program, and after she gives a few remarks, we'll take some questions, and then we'll turn it over to our presentation. So, Dr. Terry.
Thank you. Thank you, Mayor, and it's indeed a pleasure and an honor to be here this morning and to assist in launching this new summer health series. As you know, Pinnacle Health has a mission to improve health and quality of life for all of central Pennsylvania, and I do believe that our launch of this new program is part of upholding that mission. We have been a longtime partner with the city, and we're always pleased to be part of these sorts of initiatives where we're working together, collaborating, and helping to improve health of everyone across this city. I think it not only speaks well for us as an organization, but certainly for the city to adopt a Healthy Harrisburg initiative, and we certainly want to be part of that. We have partnered with the city in improving health at our Harrisburg schools. We provide nutrition education there. We relaunched the backpack program that had been pretty much dormant for many years, providing over 800 or so backpacks almost monthly. And so a lot of food is being passed out. We're also providing taste experiences at the school, enabling children in our elementary schools to learn more about healthy fruits and vegetables so that they might make healthy choices on their food. And as was mentioned by the mayor, we've certainly been part of providing health and wellness for our police force as well as for our firemen. And we are so pleased that we were in a position to be able to offer those physicals and other tests and exams at no cost to the city. And that's the way that we feel we partner. But more importantly, back in September of 2012, when we did a community health needs assessment, we did that assessment in collaboration with Hershey Medical, Penn State Hershey Medical, Holy Spirit Hospitals, and we looked at the 5-county area. And when we looked at that needs assessment, it was determined that there were 3 health priorities. One, of course, was obesity, both childhood obesity as well as adult obesity. Another area of concern was access to care. And more importantly, there was an overwhelming response for the need of health education and health promotion. So people were saying to us, we need to know more about how to be healthy, how to keep ourselves healthy. So we feel that the program today and over the next several weeks really is a response to that need that was identified. So now we're excited to be working with the city to be able to meet that need and to be able to offer these health series over the next several weeks. And today we will launch our first program, which is World-Class Fertility, Care Close to Home, and that will be presented by Dr. Nugent. And then over the next week or so, as the mayor mentioned, there will be Know Your Numbers, which is an opportunity to come in and find out where you are as it relates to your health status. We need to know where we are before we can know where we're going. And so once again, once we know what our numbers are, cholesterol, our other blood tests, then of course we can do something about it. And then the following class that will be presented by Margie Slyman, which is a discussion about childhood obesity. And I think that's a topic that we should all be part of, because whether we're a parent or a grandmother, an aunt or an uncle, we need to help our children become healthy and well. And we're hoping that we'll be able to do more as we move forward with our Healthy Harrisburg initiative. So today we're excited to launch these programs. We're excited to hear feedback from the community in regard to what else they'd like to hear about, and we will certainly look at a way of making that possible. We're also excited that each time it will be a brown bag lunch, but today there is a complimentary lunch that will be offered for all attendees. So we're excited at Pinnacle Health and pleased to be able to do that for you. So thank you very much for coming. Please spread the word. Let others know that the Healthy Harrisburg initiative is well underway and that partners such as Pinnacle Health have come to the table to not only make this possible, but to ensure the future that we can continue to make our community healthy and keep them healthy over time. So thank you very much for the opportunity to be here.
Thank you, Dr. Terry.
Thank you.
Wonderful. And just so, in case you're watching this at home, to make it clear, it is Thursday, July 24th. That's next Thursday, July 24th, 11:30 a.m. to 1:30 p.m. right here for the Know Your Numbers. Come, have your cholesterol checked, your blood pressure checked. It'll all be free right here in City Hall, and then there'll be a conversation afterwards. And bring a brown bag healthy lunch with you so that you can enjoy it while we have that conversation and discussion. And then it's Thursday, July 31st, from noon to 1, that we'll be talking about childhood obesity. So please come out and join us for that as well. So before we move to our presentation today, I just wanted to take some questions from the media. Dr. Terry or I would be happy to answer any questions you might have. Well, if there are no questions, then we've done a really good job. We have completely explained the importance of a healthy Harrisburg. Yes. This is also part of an effort on the part of the city to reinvigorate the atrium, turn it into a public space where we can have meaningful conversations about a variety of topics. Oh, a question.
I was going to say, for the initiative, is there any benefit for college students to be coming into and joining the program and the initiative, mostly for college students that are in-state or out-of-state?
Yeah, do you have, the question was specifically regarding college students, but who do you think would most benefit from this initiative? Who do you hope will turn out and come?
Well, I'm hoping, because we focus here downtown within the city, that people who work and live and play in the city area will come, but they can also invite others to come. So many of the programs are aimed towards adults, but certainly as adults, we want to be thinking about the health of our children as well as ourselves. So I think the programs are available today might be more specific to an audience, but the other programs are open to anyone who would attend. I think we're all interested in knowing about our health, our own personal health, and how to improve that. And secondly, of course, knowing about childhood obesity, which is a national epidemic. And as I mentioned earlier, our community health needs assessment demonstrated that we have a particular problem in this area with childhood obesity across all 5 counties that were in our community health needs assessment. As a matter of fact, Harrisburg is higher in childhood obesity than the rest of the state. So we really must look at those numbers. So thank you for your question. That was an excellent question.
All right. Well, very good. If there are no other questions, I will let Dr. Terry introduce our speaker today. Yep. Okay.
You mentioned childhood obesity in Harrisburg in terms of it's a problem. How long has this been a problem for Harrisburg? And how does it compare to other capitals around the U.S., if you don't mind?
In terms of how we compare with other areas and okay, I'm not clear on your question though.
How does Harrisburg compare, childhood obesity problem compare with other capitals in the U.S.?
Okay, from a standpoint of the U.S., of course, we know overall in the United States we're higher than other countries and other continents as it relates to childhood obesity. And as I mentioned earlier, childhood obesity in Harrisburg is higher than other aspects of the state. And we feel that a particular problem here relates to low physical activity, and we have aimed many programs and processes here within Harrisburg area to address that. We have a wonderful program that's called Eat Smart, Play Smart that targets childhood obesity, children ages 6 to 14. And this particular program is geared for the whole family, not only the child that's obese, but when we think about it at Pinnacle Health, I've often quoted that childhood obesity is a family affair. Because if we can't change the habits of the whole family, then we're not going to be able to address the habits of individuals. And we know, particularly with younger children, statistics have demonstrated that the parental influence is very high. And in the fall, we are also launching a program for teens that are obese. And these programs are geared to really teach them healthy habits as well. But our programs are geared to really present not only the healthy habits in their eating, but also to increase their physical activity, to decrease their screen time. We measure that each week over a period of 8 weeks, and then we track the children for about 2 years to see how they're doing in improving their childhood obesity. So going back to your initial question, we are much higher as it relates to childhood obesity, but we do have programs in place that are addressing that in this Harrisburg area. I hope I answered your question.
Another question? Yes.
Not to put you on the spot, but with the Another Number program and the screening programs, are there any follow-up programs for people who are underinsured or not insured to bring them in the system or to care for them? Because to screen people and find out they have positive results and have nothing to follow up and they are underinsured or don't have insurance is really a disservice to those who come to the
You're
screening
asking,
program
are we
next
following
week
individuals
and
outside
are
of the schools as
underinsured or
well
not insured,
that might have
and there's
issues?
positive findings. What happens then?
Yes.
Underinsured or not insured, and there's positive findings. What happens then?
Okay, as a follow-up of the screenings. Well, certainly we will provide information to individuals and encourage them to take that information to their family doctors. And if there is not a doctor, we will also advise them where maybe they could or should go to receive some help. So yes, when we do screenings, it's more than the screenings, but also follow-up is very important. So we will certainly encourage them to find a doctor to share that information with so that they can get adequate follow-up care.
If they are not
Yes.
insured.
Yes. Yes. Absolutely, and as I mentioned earlier, there are several programs underway in Harrisburg to address the needs of individuals who may not have a physician, may not have health insurance, or may not have adequate health insurance. So there are many initiatives that we have underway to bridge those gaps between individuals who either need a doctor or need follow-up care. And certainly we will be providing a lot of information on the table related to that, and I think you've brought a wonderful point to the table that we can also make people aware of what some of those programs are. Most recently, we launched the program with Capital Blue Cross, with Hamilton Health, Pinnacle Health, and the city in regard to connecting children and their families to health insurance and to existing health services. So whether they're in the school or out of the school, and we also have programs in place that help address the needs of those who are outside the parameters of healthcare, such as the homeless and other individuals. So we have a plethora of programs to address that. And I think those aspects of the health reform are certainly well being addressed here in Harrisburg.
Yeah, I'll just add that I think if you have questions about the Affordable Care Act, if you're watching at home and you're not insured or underinsured and you want more information, come out next Thursday. We'll have people here that can answer those questions. So don't let that dissuade you or act as a deterrent for coming, because you're right, it's not just about a one-time test, it's about connecting people to the larger networks and system, and the city and Pinnacle Health are committed to doing that. Yeah?
They talk about children and child obesity, and many excuses are used saying it's hereditary, when in fact it may be hereditary, but it's not genetically hereditary. It's more of a learned condition that they've eaten this or had this in their family all their life, so they continue to perpetuate that same eating pattern. Yes. And we talk about convenient foods and fast foods. There's nothing more convenient than a banana, an apple, or a piece of celery, and nothing more fast food than a banana, an apple, or a piece of celery, as opposed to a bag of chips at the corner store or something like that. And I think that we need to be more vigilant in terms of call a banana a fast food or convenient food or something like that, to change eating habits and diet habits. One can change their whole blood workup simply by their diet, and I think that's a big problem we have with our children today, that they learn fast foods and chips and corner store and that type of thing. And if we can change that mindset, and we will lower blood pressures and cholesterol levels and all those things. And the other thing I think, and in my personal life has taken a great effect, is the financial aspect of having these issues, whether it's blood pressure or cholesterol, the maintenance medication that one must take to combat these issues, when in fact you can get off of all the maintenance medicines by changing your eating habits, one, and then exercise, like taking the steps as opposed to riding the elevator as another. But that's directly affected me in my life, and I really have gotten on that bandwagon, and I wish I could perpetuate other people to get on that same path, you know. But
I think those are excellent points. Do you want to add something?
I certainly want to agree with what's being said. The impact on our diet can be significant as it relates to our health. And I think studies have shown that even if you lose 10 pounds, you can improve your blood pressure, your cholesterol, and other areas. So I think we'll hear more about this as we talk about the nutrition. And I think it's been a great advertisement for our program, not only on childhood obesity, but it's also telling us that we need to have more programs around good eating habits overall, and how that impacts your health. Thank you for those comments.
Yes, and from a city perspective, we're constantly engaged in conversations about how we can make fresh produce and fruits available to the public throughout the city. That's been an ongoing part of the Broad Street Market Task Force conversation, which we'll hear more about at the end of the summer. We have some new urban gardening initiatives with the Housing Authority and other places through the city. This is all very, very important and part of the larger conversation. It sounds like we're going to have a great discussion at noon on Thursday, July 31st, when we talk about childhood obesity. So we'll continue the conversation then. Great. And Dr. Cherry, would you like to introduce?
Yes, I think we're ready for our program, and it gives us great pleasure, of course, to introduce the first program, which is Dr. Kara D. Nugent, who is MD from RMA of Central Pennsylvania. She will be speaking on world-class fertility care close to home. So without further ado, we will introduce our program.
So, my name is Kara Wynn. I'm a physician with Reproductive Medicine Associates of Central Pennsylvania. The practice is based in Philadelphia, and very recently, about a year and a half ago, Pinnacle Health partnered with our practice to bring world-class fertility care here locally to the citizens of the area. So a little bit about me. I actually grew up in Harrisburg. I was here since 3, and I went to Holy Name of Jesus for grade school, went to Bishop McDevitt for high school, went to Penn State for my bachelor's. I did my medical school training at Jefferson Medical College in Philadelphia. I'm from this area, did all my training around here. I did my master's in public health at Johns Hopkins University. I did my residency at Christiana Care Hospital in Delaware, where they do about 9,000 deliveries a year. I did my fellowship in clinical genetics at the National Institutes of Health, so I'm a boarded geneticist as well. I did my fellowship in reproductive endocrinology and infertility at Beth Israel Deaconess Medical Center. That's one of the teaching hospitals at Harvard Medical School. So I came from Boston to move down here, And when I was finishing my fellowship, I thought to myself, you know what, where do I want to go to practice medicine after having learned all that I have learned? I left Harrisburg when I was 18, and I came back 18 years later. So the things that I was used to was world-class care, meaning going to the best centers for all of my training. So for example, where I did my infertility training, which was at Boston IVF, this center is the largest private infertility clinic in the country. They do over 4,000 IVF cycles a year. Just to give you guys a comparison, Hershey Medical Center does 80. So in comparison, the level of experience and the number of cycles that they do there is really hard to compare to any other center in the country. So one of the largest trials coming from this center was called the FAST trial. So I just mention it briefly now because I want to highlight a couple things. Because we got to do so many IVF cycles, we were able to do very meaningful studies on infertility patients. This trial has been cited over and over again in multiple publications, and basically this is the trial by which the insurance in Massachusetts has based their coverage for infertility care. So in Massachusetts, they cover in vitro fertilization because of this study that came from Boston IVF where I trained. So why RMA? So when I was leaving fellowship, I was looking to see where should I go next to bring what I've learned to wherever it is that I practice. It just so happened that Reproductive Medicine Associates, based in Philadelphia, was opening an office here in Harrisburg. It's actually in Mechanicsburg in the Frederickson Outpatient Center. And RMA was very appealing to me. I mean, besides the fact that it was close to home, but it was very appealing because this practice is internationally recognized as one of the leaders in infertility care. We are known for practicing only evidence-based medicine. They have the state-of-the-art infertility care and really the kind of science that's only offered in a few clinics in the country. We have excellent success rates, one of the best in the country. We're focused on the patient experience, so beyond the science and being to provide the best infertility care, we're very sensitive to patients' experience, so making sure that every patient, when they walk in the door, feel that they are the only patient in the office. We also offer numerous financial packages because we're very sensitive to each patient and what they're able to come in with and what they're able to afford. So RMA is the largest network of infertility clinics in the country. We have offices not only in Philadelphia and central Pennsylvania, but also in New York, Texas, New Jersey, as well as in many other states. But these are our sister clinics, so we share information on our success rates, on what works, what doesn't work with all of these centers. And these are very big centers. So New York and New Jersey each do 4,000 IVF cycles. There's a baby born from one of the RMA clinics every 3 minutes. That's how big we are, and that's how good we are. And we have a commitment to community. So I'm full-time in this area. We do education at the hospital. I teach residents, and I offer free seminars for patients. So why should you come to RMA? It's evidence-based medicine. So you get a full evaluation before you start any sort of treatment to see what the underlying reason for your infertility is. We do testing that's based only on national guidelines. Again, patient-centered treatment options. We do constant 360-degree evaluations of all of our staff, the physicians, all the nurses, and all your care providers at the practice. The committee is made up of 7 physicians, all reviewing the patients and the reasons for their infertility and what's the recommended next steps for their treatment. And our recommendations are based on proven scientific studies. So these are the physicians of the practice. Everyone is excellent. Dr. William Slaff is the chairman of the OBGYN department at Thomas Jefferson University. Dr. Goschel was the former president of the American Association of Gynecologic Laparoscopists. He's an excellent surgeon. Dr. Callan is an NIH-sponsored researcher at Jefferson Medical College. Dr. Gutman trained at Yale with one of the leaders, one of the pioneers in vitro fertilization. And they're all excellent, and they're all involved in every patient's care. So you will expect cutting-edge science, state-of-the-art fertility care. Our office is based here in Mechanicsburg, but patients will go to Philadelphia only for their treatment if they're doing IVF. We offer a number of fertility options, and this is just a list of a few of the things that we offer. We take care of patients who have cancer. We take care of same-sex couples. We take care of patients who need a gestational carrier. We take care of patients who need surgical correction of their infertility. We take care of patients who need donor egg, donor sperm. Everything including genetic testing of the embryos that are created. So some of the techniques that we use involve directly injecting the sperm into the egg, or in vitro fertilization. We culture the embryos in the dish. We transfer embryos on day 5, which is the national standard. This is where you're going to have the best pregnancy rates and also the best outcomes. Not every fertility practice does that. Okay. This is published data. Every fertility clinic has to publish the results on the database called the Society of Assisted Reproductive Technology, or SART. So it's public knowledge what our success rate is compared to any other clinic. And in our patients who are less than 35, it's among the highest, of up to almost 70% per cycle of IVF. We offer a special test called comprehensive chromosomal screening of the embryos. Again, this is something that only the RMA clinics offer. So no other fertility practice does that. So the reason why we offer it, it's very simple. Number one, it gives us a way to test the embryos, figure out which ones are the best, so that we can only transfer one embryo, not multiple. So a lot of people think that the reason why people have twins or triplets is because of IVF. It's actually not true. It's actually a misconception. With our technology, we can actually select out the best embryos, transfer one, give you an excellent pregnancy rate, but also mitigate your risk of having twins or triplets. This is Jean. She's working in our lab. So again, this is in our lab in Philadelphia. This is a study that looked at embryo testing. Basically what this slide shows is that the ongoing pregnancy rate, whether you do the testing or not, is the same, so the technique itself doesn't actually damage the embryos. This slide basically tells you that if you transfer a tested embryo, you're going to get a very high ongoing pregnancy rate, but the risk of twins is much less. Okay. We'll go to the next slide. And again, focus on the patient experience. So we have an entire team at RMA of Central Pennsylvania. It includes not only myself, but also my nurse, 2 patient services coordinators, but also the entire team at Philadelphia. So we have the financial team. I encourage all patients to have our financial team look into your insurance coverage, because you'll be surprised what your insurance cover may or may not cover. So you'll want to know that information in order to best decide what you want to do next. We have a third-party reproduction team. This is for any time you need donor sperm, donor egg, or a gestational carrier. I have my own surgical scheduling team that schedules all my surgeries, whether here downtown. I have privileges also at the new hospital across the shore and the surgery center for quick outpatient procedures. Multidisciplinary team. We work with the physicians in this area, specialists in endocrinology, urology, anything that you need in order to complete your care and make sure that it's as comprehensive as possible, and to make sure that all the physicians taking care of you know what the plan is. We have numerous financial packages. Oftentimes people think that fertility care can be expensive. It can be, but we offer a lot of things for patients. So we have an RMA program that looks at your salary, and we tailor the cost based on your salary, so it can be a tiered package. We have a special program called RMA Assure. You get, it's a money-back guarantee, not just of pregnancy, but having a baby in your arms. So that's a very special program that very few clinics can offer, but we stand behind that because we believe in our success rates. We have first responder discounts for people who are in the military, policemen, firemen, nurses, anyone who's involved in being a first responder, so we have special discounts for that. We have negotiated pricing for fertility pharmacies for their medications. We have compassionate care programs, especially for young cancer patients. So again, why would you choose RMA? It's evidence-based medicine. It's patient-centered care. We look for each individual patient's needs before we recommend certain treatments. We're committed to the community. We're full-time. I'm here 5 days a week, but the cancer specialists, they actually know to call me on evenings and weekends for patients who need urgent care right away. So our goal at the end of the day at RMA is to help you build your family, one healthy baby at a time. So I have patients who come in and ask for twins, but again, one healthy baby at a time. So this is our address and our phone number. We're very easily accessible. A lot of my patients have my email and communicate with me directly in case they have any questions. There's always a physician on call every night of the week. They get a call back within minutes. It's a part of our commitment to making sure that you have the best care at our practice. So I can field questions now if there are any in particular.
How big of a problem is infertility?
So that's actually a very good question. And about 90% of couples who are going out to build their family, they're successful. But the studies show that up to 15% of couples have some sort of problem. And we always evaluate both the man and the woman in the relationship because the infertility causes can be in either one of them or maybe in both of them. So we always do that up front, but it can be up to 15% of the population. And the studies have shown that historically, when you look back in time, over the decades, it's becoming more and more of a problem for reasons people don't really know why, but a part of the reason is that young women are choosing their careers before having a family. And so people are delaying childbearing. There are studies that show that for some reason, men are becoming more and more infertile in the population. So it's going to become a more prevalent problem. In the past, there wasn't a fertility practice in this area that served all the needs that patients have, but now there is.
You've answered a couple of my questions, but what is the cause of this?
So the cost is going to be different depending on every patient. So I always tell patients, don't ask me about the cost, let our financial team look into that because, again, most patients are surprised by what their insurance will cover. So,
I'm sorry, not cause.
Oh.
Cause. What's
Causes of
is it
infertility. Okay.
What is it?
Okay.
Or what are the main reasons?
So I tell my patients there are 4 basic things that you need in order to get pregnant. You need good eggs, you need good sperm, you need open fallopian tubes so that the egg and sperm can meet, and then you need a good uterus or home for the pregnancy to grow. Those are the 4 basic things, and we tailor our evaluation to make sure that you have those 4 essential things. So for example, if we do the testing and it shows that you don't have a good ovarian reserve, that might prompt you to seek treatment sooner rather than later. Don't continue trying on your own. If you wanted to have a baby, maybe say last year, if your tubes are blocked, if the sperm quality isn't very good, or if there's a low count, or if they're not moving, those things are major reasons why you would have a problem. Some women might have structures inside their uterus. that may make it more difficult for a pregnancy to implant, or maybe increase the risk of miscarriage. So they're infertile in a different way, that they can get pregnant but just keep losing the pregnancies. So there are a lot of different underlying reasons. The testing that's available can look at those major reasons, but beyond that, in about 10% of couples, they end up with a diagnosis that's very unsatisfying, which is unexplained infertility, where the testing we have can't identify those major reasons, but in those cases, those are more subtle reasons why a couple might have a hard time getting pregnant. And so it requires a little bit deeper evaluation.
You raised the issue that you also serve same-sex couples. I found that interesting. Clearly, you're seeing an increase in probably demand from same-sex couples. But would you talk a little bit about those services?
Sure. So we have patients who are same-sex female couples who want to get pregnant using donor sperm. So we direct them towards donor sperm agencies, and there are several very respected agencies in the country for them to choose from. Those treatments are very simple. But then I have some same-sex couples, female partners, who want to do something called partner-assisted reproduction, where they want to use the eggs of one woman, donor sperm to fertilize them, and then have the other woman carry the pregnancy so that they both share in the process of having a baby. So that's something that we do as well. In our same-sex male couples, we offer donor egg. They will need gestational carriers, and these men will then contribute to that process as well. I believe Hershey Medical Center does not actually treat same-sex couples, so I oftentimes get a lot of those patients. Okay, so I'm readily accessible. My information is back on the table. Please feel free to collect that information maybe for yourselves or family or friends you might know, and just call, and you can usually make an appointment within a few days.